In fears of ventilator shortages as COVID-19 cases increased, but a team of common-minded critical care clinical experts in South Africa developed the first of its kind non-invasive breathing system. How does this work? We're joined by Laurence Savage. He's the CEO of NIBS. Laurence, good evening. Thank you so much for your time tonight. I'm wondering, non-invasive, safe, how does it all work?
Well, good evening, and thank you very much for having us tonight, and welcome to all the viewers. Firstly, we've designed a BiPAP CPAP, so that's a huge mouthful, but what it simply means is that it's 2 levels of pressure that are continuously and positively driven into the patient's lungs. So you're able to actually have the patient breathe in a higher level of airflow, and then it gives them a reprieve to exhale. And this device is obviously safe and reliable in that it doesn't actually require intubation. So you don't have to put tubes down the patient's throat or sedate them or go to that next level of treatment. So effectively, this staves off the impending ventilator shortage. The ventilator itself, or the CPAP unit that we have, effectively has gone through all the regulatory qualifications. It's designed by ventilator engineers specifically for the use of COVID, but also offers the opportunity to use it post-COVID. And we certainly believe that there's a huge number of advantages in using such a device prior to the patient getting to a point of no return and requiring invasive ventilation.
And let's talk about, the uptake here. What has it been like? Are you finding that hospitals are eager to use this?
So we've had a huge amount of enthusiasm, and we've taken this to a lot of clinicians, professors in this field, and particularly ICU specialists. And the positive thing for these guys and our medical clinicians is that it's a step before you have to actually take the patient onto ventilation and into ICU. It can be used by a layman essentially, because it isn't dangerous and it isn't a threat to the patient's standing health. So there's been visits to KZN down to the Eastern Cape. This afternoon we were talking to doctors down in Sebokeng, and they're hugely enthusiastic about us rolling the product out. I think there are some benefits that are quite unique in that it is a closed system. So what that means is that if the patient does have COVID, you put a mask over them, and the nurses and the medical staff around them do not have the probability of being infected by the virus. It has a dual filter system that first of all filters the air that is going into the patient, and secondly, when the patient exhales, it goes through a filter. And I think that's really important around the contamination. The other big matter that has really cropped up in recent weeks is that there's a pending shortage of oxygen. And oxygen is a scarce resource in any environment where they're encountering COVID. And by using this device, it's simply an enormous amount lower usage relative to a high-flow nasal cannula system or an equivalent, where they're using probably in the region of 4 times the amount of oxygen per minute compared to our NIBS non-invasive breathing system.
As a final question from me tonight, would you be ready for a massive rollout should you get the go-ahead, particularly from those hospitals that you've been to?
Yeah, so we do have the capacity to do an immediate rollout in the short term of probably in the region of 2,500 units within the first month. So these are big numbers, but we have the facilities of manufacturing. We have shepherded a number of our associated partners in the industry, and everybody is absolutely willing and committed to us because they see the product has been approved by the South African Health Products Regulatory Authority. It's a quality product, and the clinicians like it. And I think that's the real essence. The guys that are behind this, the Erics and the Shawns and the engineers that have put this together, have ensured that we can be proudly South Africans with our own product and our own invention that is going to serve our people.